Hey guys, Jeff Lewis from Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey here. I want to talk to you guys today about one of the more common soft tissue injuries I see in baseball players, specifically position players, and that's hamstring injuries. So we hear a lot of times about hamstring injuries in football, and if either you played football or you have a football background as a PT, you probably saw a ton of hamstring injuries, especially during the preseason time of year. But hamstring injuries are talked about and happen pretty commonly in baseball, especially in position players. And most common causes or most common times that I see base running happen or hamstring injuries happen is during base running or outfield. Three times outfielders trying to run down a ball, or in infielders when they try to make a quick play to field a ground ball. So those are three common times I see these happen. I will add on here the fourth that I do see in pitchers sometimes is you will typically see it in their lead leg because they have to stabilize over that leg. Doesn't happen as much, but if you have someone that plays two ways, it is something that's a consideration in terms of when you get them back to pitching off the mound more than anything. So the common signs of a hamstring injury. Usually it is running at full intensity and you feel either a grab, a pull, or a pop behind the back leg. And you'll see guys immediately pull up and they'll grab the back of their leg. For higher grade hamstring tears, like partial grade hamstring tears, guys are going to have some problems walking at first. And if you even have a low grade hamstring, the first day or so, you might have a little bit of some problems walking just because it's so acute. But in general, guys that have a higher grade hamstring tear, they're going to have more trouble walking just because every time you walk, you're stressing and stretching that hamstring more than anything. So the other typical signs and symptoms you'll see, you might see some bruising behind the thigh there. Again, in the more higher grade injuries, like we talked about, some pain with walking, squatting, so like getting up and down from a chair might be bothersome. But those are really the typical signs and symptoms of a hamstring strain. One thing I will talk about here is not necessarily a true hamstring strain, but a hamstring spasm or cramp, because sometimes the spasm or cramp is mistaken as a hamstring injury. Now, we still want to do our due diligence, and at that point, it's more a matter of making sure we rule out that it's not a hamstring injury. But for the hamstring spasm or cramps, you'll just guys will feel really that they just tighten up, or might be a gradual tighten up. It's not as aggressive as that big just pull grabbing sensation on the back of their leg. They'll just notice likely a gradual tightening of that hamstring. Their strength might not be affected, so they might still have good strength. They might have decent enough range of motion where it's not painful, but it's just tight more than anything. And with those guys, you really just want to monitor them on a day-to-day basis. So, we really see at that point, hey, how do they come in the next day or the next session? Are they starting to move backwards, closer to like a hamstring strain where it's now painful to walk? They can't squat. They don't have great strength testing because their strength testing is painful and weak. If those things are starting to pop up, or if they have bruising, that's likely leaning more towards that hamstring strain more than anything. But if they come in 2 or 3 days and they're really, for the most part, pretty improved, then we're probably going to have them go do some running just to really stress and see how that hamstring is tolerating. So again, that's how we typically see hamstring strains present in baseball players against mainly position players. Not that it can't happen in pitchers, because I've seen it and it does, but it's just more commonly happening in position players because it's usually high speed running and quick change of directions that result in the hamstring becoming injured. So if you're a baseball player, you're dealing with a hamstring injury, you're not sure if the rehab that you're going through right now is putting you in the best position to succeed to get back to play, go ahead and comment below with any questions you have. Go ahead and like and subscribe to our channel. We put out a lot of content specific to baseball players, or check out some of our free resources down below specifically for baseball players.